in Australia, we have this kind of cultural silence around women's aging. It's supposed to be something that just happens in the background.
Menopause is not a choice. So, why can't we discuss it openly?
Why are our yoga spaces looking better than our medical practices?
85% of women will go and talk to their doctor and mention the cliche symptoms of menopause, right? Only 10% right now be offered treatment, and it's usually an antidepressant.
If it happened to men, I think we would treat it differently.
Throughout history, menopause has been surrounded by silence, leaving millions of women without the necessary care to manage their symptoms. But as research builds and more women speak up, menopause is finally having its wellness moment, giving rise to more nuanced conversations and holistic mind-body treatments. One of the pioneers in this space is Ponte Health, a medical clinic that specialises in peri to postmenopausal transition. This is Hema Prakash, its CEO and co-founder, who's using her own experience to transform the future of women's healthcare.
I'm 51 now, and I started, I think, at 39 and 40 with abnormal bleeding, and the brain fog only hit at 47. I only started HRT at 47, but I was working in quite serious jobs between, I still am, 39 to 47, and I didn't get the care I wanted or I even knew to ask. So that was one aspect of it. I actually also got very angry because with access, being married to a medical professional, with all the access that I had, I still couldn't get the care I needed. I think I would have seen 55, 60 doctors and spent so much money on vitamins, all manner of massages, chiropractor, physio. I'm not saying one is worse than the other, but I was desperate to get some relief for my own symptoms. And 6-week wait list, 8-week wait list, 6 months, that is not care. That is literally grasping at straws. And the person that suffers is the woman at the other end. So we pretty much removed as many of those friction points as possible. Everything is here, so you don't have to scramble around town. And when a letter goes from the GP rooms to a psychiatry room or to the dietitian's room, it's all within the one system. And that conversation just keeps evolving. So the multidisciplinary team approach to healthcare is what Ponte is about.
In addition to new approaches to healthcare, leading wellness companies are also starting to fill the gaps. One example is Gaia, a renowned retreat centre that recently launched a 4-day experience specifically for women transitioning through menopause.
We do a really big consultation at the start of the retreat, and that is to tailor the entire experience around what the individual needs as a whole being. Everyone's symptoms are really varied. Some of them are a little bit more psychological, some of them are really physical. So from that consultation, we build the retreat around everyone's unique needs. I think when we go with the Western approach, we might alleviate a certain symptom with hormone replacement therapy, but you still have those emotional and mental changes, which can often be as overwhelming as the physical ones. Changes to our bodies that we're noticing, helping women cope with stress, mood. So I think that's some of the biggest feedback we've received, is just this relief of feeling heard.
With an ageing population, demand for menopause care will only continue to grow. And as it does, the conversation surrounding menopause will also begin to shift, marking the end of silence and shame and the start of greater acceptance and celebration.
You actually have to accept that you might be experiencing perimenopause or menopause, which is a really big step for a lot of women because our society doesn't put any value on women aging. We put our value on anti-aging, and there's 500 times the products for anti-aging to what we can find for healthy aging.
I had a friend recently say, I don't think I'm in menopause. I'm like, dude, it's happening. It has to happen, right? Just as much as we hit a point when we hit puberty, you are going to hit menopause. So there is a lot of stigma because our mums didn't necessarily talk about it. My one ask for everyone is go speak to your mums. Boys and girls, go speak to your mothers about their experiences because that narrative is what's going to change us and our future selves. But the stigma's definitely still there. We've had hundreds and hundreds walk in. We're so fortunate to have seen this idea flourish the way it has. But it's because of the patients that are being brave enough that have come in
I'm going to be heading into perimenopause and menopause myself, and I hope that there's a world where I exist, that I feel empowered, that there's space for me, that there's support for me and for my daughter. And it's about, doing our bit, each generation just trying to chip away at these little things and create small improvements.